Hey, we're back. We've got our traditional English breakfast. Now we take care of our teeth. Don't forget to brush. From Lynden Hills Dentistry, we've got Dr. Nader Jahshan with us. Thanks for coming in again today.
Thanks for having me, Ted.
You know what? When I drive down, Lynden Road and I see a nice sign outside, and you talk about dental emergencies. And one of the things I want to hit off the top, a dental emergency, when should somebody make your phone ring?
Well, when there's a dental emergency, the sooner the better. So really, immediately is...
Key pain or the key, I don't feel something right?
Well, either one, when there's pain or something wrong, and especially with sports, when there's an accident and a tooth breaks, the sooner the better.
Do you get some people saying, oh, I don't want to bother the doctor, but you've got a big sign out there that says, bother me?
Yeah, I mean, that's what we're here for. We're here to help and we're here to serve. And especially when there is an emergency, time is of the essence, If a tooth gets knocked out, the sooner we can get it back in, the better the chances of surviving.
And we're going to talk about spending a little and maybe saving a lot right now, because we're going to talk about preventing dental injuries. And we're going to talk about mouth guards, and there are different choices. What variety are you looking at there in your hands?
Well, this type of mouth guard is a custom fitted mouth guard, and this kind of mouth guard offers the most protection that there is out there.
What's going to be neat for somebody is you hold that up and they see it on camera, they're going to think that's attached to the teeth.
Pretty much, it's vacuum formed, so it's a very tight fitting mouth guard, and even to remove it, a person has to put all their fingers in their mouth just to pull it off. So it's very, very comfortable, and that way it offers the most protection. Now,
if the player goes out and gets that done, or the parents get it done for the player, there's nothing more annoying than seeing them not have it on. So I guess the main key is that get that in there and don't turn it into a chew toy.
Absolutely. It only works when it's in the mouth.
Yeah. So now there are different other kinds of mouth guards that somebody, I guess this is the Cadillac?
This is the Cadillac. This is the standard, for most sports and for professional sports. There are other types out there that are over the counter, but they are very limited in the type of protection and in the comfort that they have. And one of the most important things is with a mouth guard is, especially, if someone goes with an over-the-counter mouth guard, it doesn't offer the same protection because it doesn't fit as well.
And we're looking at your friend on the screen right now, and I was kind of surprised. Everybody's talking about mouth guards because, of course, if the jaw's in place, you're reducing the risk of concussion. But I guess there's dental trauma that can last for years that can happen as a result of not wearing the proper mouth guard?
Absolutely. Most accidents are actually not damage to the teeth. Most accidents happen to the jaw, so it's usually a blow to the bottom of the jaw. And what happens in that case is all that force goes right up and right into the TMJ. So either there's a fracture that happens there, or it causes a lot of damage and stretching of the tendons. And so for years after that, there's a lot of problems with the joint and pain and clicking and popping.
Now, when you said the
TMJ, the temporomandibular joint, which is this right here.
So that's basically, and you're going to feel that, and you're going to be maybe thinking it's something else when in reality you may have suffered the trauma a while back.
Absolutely, it could have been just the trauma, because most traumas, especially a blow to the side, will shift the jaw over to one side like this.
And down the line, of course, I guess with the formation of teeth, you could end up with an uneven bite.
And yeah, absolutely, it can change the bite, it can damage the joint, so it doesn't work properly after that.
There really isn't a sport where you shouldn't be wearing a mouth guard, is there?
Maybe curling.
Yeah, you don't get a lot of people hitting you in the mouth with a broom.
No.
But I think in terms of when I coached young kids in baseball, I had them wearing mouth guards.
Absolutely, yeah. Baseball, basketball, hockey especially is a big one. Any sport where there's a potential for contact, especially to the face, it's recommended.
So if you get a patient and they get in touch with you and say, listen, I'd like to be able to do this, what kind of procedure are we talking about? How long does it take to get something put together?
Well, it's very easy. The first appointment, we make some models of the teeth, and then we have it made. It takes about a week. And then the second appointment, we just make sure that it fits comfortably and it works well, and they can function with it. And
we talked about the Cadillac. That will be the most comfortable mouth guard, though, because we had struggles with my son because he hated having something in his mouth.
Yeah, it is the Cadillac, but it's very cheap to have made, and especially when we have the sports guard clinic, it's very cheap for kids, and it's very affordable. So it's not that much more than.
In your next visit, we're going to have to get into those little injuries that occur, because we had too much fun talking about preventing injuries. But again, I want to reaffirm one thing: when in doubt, make the phone ring.
Yes, absolutely.
Dr. Nader Jahshan, thanks for coming in today.
Thank you for having me.
From Lynden Hills Dentistry.